Hello, my name is Todd Stubendek, and I'm the State Director of AARP Nebraska. AARP is a nonprofit, nonpartisan organization that works across Nebraska to strengthen communities and advocate for the issues that matter most to families and those age 50 plus, such as healthcare, financial security, caregiving, retirement planning, and protection from financial abuse. Today, we're going to talk a little bit more about our advocacy work and specifically about some important legislation that is currently being considered in the Nebraska Legislature regarding telehealth. Joining me today to talk about this issue is Bob Lassen, who is an AARP Nebraska Advocacy Lead Volunteer. Welcome, Bob.
Hi, Todd. Thanks for having me today.
So we're talking a little bit about telehealth today. Can you tell me a little bit more about this bill?
Yes, this year, Senator Arch, who is from District 14, that's kind of north central Nebraska, introduced LB400. And under this bill, the definition of telehealth for the purposes of domestic insurance, which means insurance companies have to pay for it, is amended to include audio-only services. Up until this point, we had to have visual contact between the patient and the provider. But this allows for just the audio of the phone. And this is specifically for behavioral health. I should point that out. What LB400 does is it would amend the Nebraska Telehealth Act to allow for a patient to have an option to give verbal consent, because we have to have that for billing portion of it, in lieu of a written consent. Now, when the practitioner, whether it's a healthcare physician or psychologist, when they embark on this electronic format to this audio thing, the provider has to explain all the circumstances, all the conditions, all that, and then after the patient or the recipient understands that, then this can be in lieu of a written agreement. Be done electronically. So that's new. That allows the electronics for that. It eliminates the original requirement that insurance companies demonstrated compliance to that, because again, up until this point, the insurance companies had to have that in place before they could actually pay for it. And it expands the definition to what is actually acceptable for telehealth for the originating site. Now, this is important because it allows that originating site to be anywhere where the patient is. So if they're home, or if they're in an emergency situation in the hospital, whatever, they can have that be the originating site. It doesn't have to be at a clinic or something like that. And then it the last thing, it expands the definition of telehealth to include the audio portion of it that we mentioned, but it also allows for such things as monitoring for vital signs and that sort of thing. AARP has supported the expansion of the definition of telehealth, which will positively impact seniors, especially those receiving home and community-based long-term care. So,
very good. Can you tell me a little bit more about why this bill and this issue is so important to folks 50 plus?
Sure. Allowing persons to receive health care via phone only is important advancement in the care of patients and seniors who are not comfortable either interacting with a physician or visual type contact. So this frees up the ability to have that interaction. In June, AARP Research released a report about older adults and the awareness of attitudes regarding telehealth. Research shows that the older adults are increasingly comfortable with telehealth and are willing to use technology to interact with the healthcare providers. As the pandemic continues and emotional and economic stressors are more of a pressure, we see telehealth as more of an answer for meeting those needs, again, at that originating site, wherever that may be. So AARP supports this coverage and this payment.
Very good, thank you. It has become one of those issues that the pandemic has definitely shown us the importance of telehealth and in filling that void and allowing greater access to healthcare across our state.
This is the technologies are really, really important, because this with the virtual and the audio allows family caregivers to be involved in those conversations with the providers too. So that's an important element. Plus the traveling for appointments and weather-related things and rural placement, away from specialists and things like that. So it's a very important bill.
Very good. And again, as you mentioned, we thank Senator John Arch for introducing this bill. It was originally referred to the Health and Human Services Committee and had a hearing on February 5th. It's advanced out of committee and actually cleared several hurdles on the floor, and we're hopeful that it will soon be heading towards final passage. Bob, can you tell us what happens after the bill is passed on the floor?
Well, after the bill is passed, and I'm going to go back here just for one other provision, that there was an amendment added to this bill. And what the amendment did essentially was say that pre-existing conditions where we had a relationship already established, that they could kind of just pick up right from that point and do audio. So people that have been longtime patients would be accepted into this audio portion of it without going through any additional clearance. Now the bill itself, after it goes through all of the hurdles and select file, I guess is the last one that it's been through, and then it's up to the governor. He has to sign that, and that's where it's very important that people reach out to their senators and stress the importance of this particular bill. AARP feels that this is kind of a stepping stone. Right now we're talking about behavioral health, but we'd like to see this expanded to all persons over 65 or 55, as a matter of fact, to allow them to have this opportunity for audio only.
Very good. As Bob mentioned, it's important for folks to reach out to their senators and let them know how they feel on this and other pieces of legislation important to people 50 plus. We're going to put on the screen a link to where you can go to the Nebraska Legislature if you don't know who your senator is, and you can just put in your zip code and it will give you who your senator is and access to their webpage where you can find a phone number and call, or you can also find their email and reach out to them and talk about this bill or, again, other bills that are important. Bob, you are so good at contacting our state senators and talking with them. Any advice that you'd give to anyone about what they should say and how they should say it if they're reaching out to?
Well, I think that one of the main points that you have to understand, the senators are just people, and they appreciate the interactions that they have from the constituents, particularly. Again, the people that voted, and again, if we have 5 people that actually sit down and contact the office, that's a big number for a senator. So your votes are important, and your conversations are too. I think that if I was giving any information, suggestions, or anything like that, you can email, you can send letters, you can call. And most of the times, you're not going to talk to the senators themselves, but the aides are very well versed on the information on these various bills, and certainly that information will be taken to the senator themselves. Now, another way you can do that, when you know your senator from your area, and again, as Todd mentioned, you can go to the legislature website and find that. But another thing that you can do is get on the mailing list for your senator. But now, personally, I know that in our district that our senator is very responsive to emails to him, and I'm sure that holds true of most senators.
Very good. Thank you, Bob. Thank you, first of all, for providing such great information on the telehealth bill, and thank you for all of your work as a lead advocacy volunteer. If you want to find more information, you can definitely go to the legislature website and find more information on LB400. And again, we thank you for watching our presentation today. Thanks.
Thank you.